आप सुन रहे हैं एबीसी रेडियो WWTR 1170 AM ब्रिज वाटर, आपकी चॉइस।
एबीसी रेडियो आपकी चॉइस 1170 AM।
Good afternoon, friends. You're listening to EBC Radio 1170 AM Aapki Choice, and I am your host Alka. As you all know, September is a prostate cancer awareness month, and this is the show called Health Education Series, which is brought to you by Robert Wood Johnson Barnabas Health. And as we are talking that September is a prostate cancer awareness month, we are going to be talking to Dr. Saraiya. He is a medical oncologist in the urology oncology program at Rutgers Cancer Institute and Robert Wood Johnson Barnabas Health. He is also the medical director of the Office of Human Research Services at Rutgers Cancer Institute and an associate professor of medicine, Division of Medical Oncology and Section of Solid Tumor, Rutgers Robert Wood Johnson Medical School. Dr. Saraiya's clinical expertise includes prostate cancer, kidney cancer, testicular cancer, and bladder cancer. He is also board certified in palliative care and continues to teach the principles of palliative care to medical students, residents, fellows, and practicing physicians. Dr. Saraiya works closely with basic research scientists and clinical researchers at Rutgers Cancer Institute to develop new therapies for genitourinary cancers and stay aware of the latest treatments, technologies, and communication aspects so that he can provide the best care to the community. So with that, Dr. Saraiya, a very warm welcome on EBC Radio. How are you doing?
I'm doing very well. Thank you, Olga, for inviting me and letting me part of this program.
Well, it's a privilege and honor to have you, such a qualified and knowledgeable doctor, to be on EBC Radio and give education to our listeners. And prostate cancer is like something very much happening in the South Asian community, as I hear a lot from people here and there. So let's start. What is prostate actually?
So prostate is a gland that all males have. It is something that produces some enzymes and hormones that help our sperm function, and so it sits right where the tube that connects our bladder to the outside, something called urethra, at the base of the bladder. So it's something that is pretty small when we are very young, and as we age, as men ages, it over time becomes a bit enlarged. And so this is something that can sometimes cause some symptoms as we get older, with just having difficulty with emptying the bladder. So many listeners may be sort of familiar with something called benign prostatic hypertrophy, or BPH, that happens as we sort of age. And that's what the P is the prostate in that.
Okay. So let's get into the cancer factor now. So what are the risk factors for prostate cancer? Like, as people may not know, everybody's living their daily life, and I don't know when is the right time and how do they know that they have something which is called prostate cancer?
So the biggest risk factor actually is age. The longer we are alive, more risk that we will have adult prostate cancer. We know that in our lifetime, 1 in 8 men will develop prostate cancer. And what's really unique about prostate cancer, and this is something that's important for all of us to know, is not every prostate cancer requires treatment, which is sort of really hard for you to fathom or think about. But there are some prostate cancer that do not cause any problems in terms of how a person lives or how long they live. Obviously, the people I take care of, that's not the case. But think about the community as general, we will see prostate cancer a lot if you just talk about it. 1 in 8 person will develop, 1 in 8 men will develop prostate cancer in our lifetime. So, if you talk to your neighbors, talk to your family members, if you talk enough, you'll sort of find out someone has it.
Okay.
Besides age, family history is very important. There are some cancers that happen in the families, and prostate cancer is one of them. So if you have a family history of, for example, let's say breast cancer, pancreatic cancer, some of the intestinal cancers, there is association of having prostate cancer as well. Obviously, if there's a family history of prostate cancer, that's important too, especially it happens in the earlier age, meaning if someone in your family had prostate cancer age 50, for example, or even 60, that would be potentially a risk factor for you to have a prostate cancer, because many times it's a genetic change that is causing the risk of the prostate cancer to be developed.
Okay. So, like people who have some history, they should be a little more cautious. Everyone should be, routinely checking with their physicians. But if they have some history, that is little more attention has to be taken there.
Yeah, I think the way I would sort of phrase this is that if your primary care doctor is your first person to speak with, and what happens for most patients, most people, is if there's a family history, the primary care doctor will talk about doing a test called PSA, or prostate-specific antigen. It's a blood test. It is a screening test, meaning it does not diagnose cancer. It just tells us maybe someone is at risk for it. And the primary care doctor will make a decision who to order this for. So, for example, if someone is frail, that we don't think that, that they can do any treatment, so we should be recommending treatments, no need to do the test. But someone who's young, above 50, or someone who has a family history, maybe about 10 years before the initial diagnosis in their family, we could consider checking a PSA once a year and seeing what happens to it. There is an absolute number of 4. If it's higher than that 4, that means more attention is required. Okay. Alternatively, if they have PSA that sort of really rises really fast, and attention requires, and attention is going to be seeing a urologist, a doctor, a surgeon, who can really evaluate this fully.
Okay. So, like normally, doctor, we hear like they have to do the biopsy of any kind of cancer or any tumor or anything you see. So, same thing here with the prostate. If they find it's an enlarged, so do you think the urology or whoever the right physician for them to see, they may do the biopsy as well at that point?
Yeah. So there are 2 ways sort of patients get to urologists. One is they have a high PSA, which is well, the primary doctor may have ordered it and then say, hey, listen, this is something that requires further attention. It does not mean there's cancer. The second way is many times patient may have symptoms. They have symptom of, hesitancy with urination, can't empty the bladder. And then many times that's a benign thing. That's not necessarily a cancer. That's not a cancer issue. It's just a prostate being enlarged, which, as I said earlier, something that many men will suffer from as we age. And so urologists with the doctor will sort of address that. And as part of the evaluation, they may do a examination to see if they can feel the prostate. And based on the examination, based on the blood test, based on the symptoms, they might do additional workup, including getting a biopsy or getting an MRI or to do some additional testing to see if there's any evidence of cancer.
All right.
The only way they can diagnose cancer is by a biopsy.
Okay. So that's good to know. So now tell me, like, what are some of the symptoms of prostate cancer if somebody is really developing that? So what are the symptoms they would feel?
This is really challenging because there's no one symptom or symptom that we can sort of anticipate or say, listen, watch out for this. As I said earlier, enlarged prostate is causes for many men trouble with urination, but that could also be a symptom of prostate cancer. And vice versa. And on the other side, you don't have to have the symptom to have prostate cancer. Many times, prostate cancer, if it is in the, it's a gland, size of an almond or walnut. If it's not in the central area, it may not cause any problems. So this is where the blood test and examination by a doctor becomes really important. And you may not have any symptoms. Okay. occasionally I see patients with symptoms, and then the symptoms have happened because prostate cancer has already spread outside the prostate. And that's when sort of a doctor like me, or a medical oncologist, may get involved in the care earlier on. For the most part, otherwise, this is something that's managed by the urologist, colleagues of mine who are surgeons.
Okay. Friends, we are talking to Dr. Biren Saraiya, and he's a medical oncologist in the urology oncology program at Rutgers Cancer Institute and Robert Wood Johnson, Barnabas Health. And today our topic is on the prostate cancer, and I hope you are getting a lot of good education from Dr. Saraiya. He's taking his valuable time out to explain our listeners what is prostate cancer and what are the symptoms and different treatments and all we are talking right now. So, doctor, tell me, how does prostate cancer impact the South Asian community?
This is same. While there is no risk factors based on diet or things like that, so our community gets impacted just like any other communities. So I would anticipate about 1 in 8 men getting prostate cancer. Now, again, I because I practice in Central Jersey, I certainly have a lot of patients from our community that I see and take care of. So I would say that this is just as normal as any other community in terms of having risk of prostate cancer. The most important thing is absolutely the family history. If you have it, please make sure you tell your doctors and get the appropriate screening test done.
So early screening is always very helpful, right? So what should people know about prostate cancer screening and who is eligible? How often should they be screened and etc.? Can you talk a little about that?
Yeah. So typically we recommend starting at age about 50, of having a PSA, the blood test, once a year, and a digital rectal examination. The second part of the thing is if you have family history, then maybe earlier, 10 years before the youngest person was diagnosed with prostate cancer. So it could be slightly earlier than 50.
Okay.
The key here is really the conversation. And as I said earlier, not every prostate cancer requires treatment. And so we have prostate cancer that can be really slow growing and may not cause a problem in a lifetime. And everyone has to know that before they get the testing done. I think that's really important. And we won't know until the biopsy which one it is. So that's why the conversation with your primary doctor is so important.
So, doctor, don't you think, as you say, it's not necessary? I'm sure you know what type of prostate cancer should be treated and what can be just left the way it is. But the person who is going through and he knows he has this cancer and no treatment is getting done, so what would be his mental state?
It's a really good question. I just met someone yesterday where we had this conversation. I spent about an hour with him and his wife. So this is why having this conversation with your primary doctor, just knowing that, or listening to us today, just knowing that is okay is the first step. Because anyone when they hear the word cancer, their mouth drops, their spirits drop. It's a very common reaction that everyone has. The reason that I'm sort of talking about this today is really to educate everyone that A, yes, the cancer exists, but let's sort of talk about what that actually means, and talk to your doctor about what would that mean for me. So as I said, there are cancers that are very low grade, meaning they grow very slowly, and if that's the case, the urologist, even sometimes patients come and see me because they want a second opinion or something like that. We talk to patients about, hey, these are the risks, this is the benefit, and one of the things we talk about is something called active surveillance, where we don't ignore the cancer. We say, okay, we're going to check the PSA again, we're going to get another MRI and another test, we're going to get another biopsy to make sure nothing has changed. The idea is not that we will never treat you. And that is that we don't need the treatment because it's not going to cause a problem. And that treatment itself may cause more problems than the cancer can. And that's the balancing act that the doctor is trying to make with you. And I think having hopefully heard this conversation, there'll be less anxiety to begin with. so we can have a better conversation with the doctors and get the best advice.
Yeah. With all due respect, doctor, I know surgery and treatments and all are, wonderful, but whatever original organ and the body part each individual has, if it stays the same way, that's the best. Then I feel like for anything, the original is the original, right?
I said, listen, I think at a personal level, I feel the same way. I think it really comes down to, and this is the conversation I have with my patients, and I know my colleagues do as well, which is who actually needs help? Who needs our help? Who needs our intervention? And we have to be very mindful of that. And that's what we try to do as doctors, provide the best advice that we can.
Yes, I know. And Rutgers Cancer Institute with Robert Wood Johnson Barnabas Health has the best doctors, and the whole area. I know I've talked to so many doctors, and that's the best place to get treated and to talk to the doctors to further advice as well. So now, doctor, tell me, how is prostate cancer treated?
So once we make the decision that there is something that needs to be done, we try to classify the cancer into something what we call is just in the prostate or local, or is it outside the prostate? If it is localized, it's only the prostate, then we have our patients see what we call multidisciplinary team, multiple doctors with expertise to address it. So it would be a surgeon, a urologist, oncologist, or urologist. It would be a radiation oncologist, because both treatments can be curative, meaning that after their procedure and their recovery, patient would have follow-up for up to 5 years, but they're expected to be cured and not have the cancer ever return. Occasionally, we have cancer that presents with cancer already outside the prostate, in which case they will get to meet either someone like me or my colleagues in medical oncology, and we work with the same team of surgeons and radiation oncologists to come up with a plan that addresses the cancer in a multi-pronged approach. We will do therapy like hormone therapies and, if necessary, chemotherapy, along with radiation and or surgery to address the cancer, to control the cancer, and hopefully make its impact minimal in the patient's lifetime so they can live a normal life.
That is good to know. Yeah. So, doctor, tell me, what is the benefit of receiving this type of care at the National Cancer Institute designated comprehensive cancer center like Rutgers Cancer Institute and Robert Wood Johnson Barnabas Health?
I think the best thing is having a expert opinion. When you introduced me, you said, I only focus on 3 or 4 cancers, and that's absolutely true. Prostate cancer is probably half of my practice. So every day I come into the office, see patients. This is the only thing I do. That naturally makes me have a high volume. When our surgeons are doing this treatment, this is the only thing they do. So they do many more surgeries. They're proficient in it. Their outcomes for patients into the function, urinary function, and bladder control, there's no leakage, or erectile function is optimized. So I think going to an expert is probably the most important thing. The second most important thing, I think, I'm so proud of the fact that not only do we take care of patients, we take really good of patients because we offer the latest technology and latest clinical trials. As you initially mentioned, I lead our clinical research program here. We try to find the next best treatments. I just posted on my LinkedIn yesterday where we published a phase 1 study that was done here for different bladder cancer and kidney cancer. But this is something that I'm part of. I'm so proud to be part of that, where we found new types of treatment that help patients with, in that case, bladder cancer. But we do on a day-to-day basis offer patients clinical trials of the latest technology and latest drugs when available. And so that's the second part. So expert advice, best possible treatments. And the third thing is, when you come here, you get opinion from all of us together. I talked to a multidisciplinary team. We work together, we work side by side. And I think that's the best possible outcome that you can expect from a cancer perspective. When you have really, really smart people, dedicated people working on really addressing the cancer, you get the best outcomes.
Very, very, very nicely you have put this together, Doctor, and explained it very nicely. And I also heard, Doctor, that there's some latest in prostate cancer diagnosis and treatment. Something has come up?
Yeah. So in the past few years, we have developed, not we, but the community itself has developed better imaging testing, so something called prostate-specific membrane antigen. Mm-hmm. And it has really interesting benefits. It finds a cancer when it's very small. So it's a PET scan, so it can find something. It doesn't mean that it can actually, do much with it until we've sort of found that there is actually therapies we can attach at a molecular level to the PSMA, so that the therapies, radiation therapy in that case, goes to where the PSMA is expressed and tries to emit energy, radiation energy, to try to kill the cancer cells. And so we've been really studying this in the past 5 years to better diagnose cancer, better stage the cancer, and really better treat the cancer. And that work is ongoing.
Okay. So that's good to hear. And now for our listeners, for more information, if you need what doctor just talked and you want to reach out to him also, you can always reach to www.rwjbh.org/beatcancer. Again, rwjbh.org/beatcancer. And we were talking to Dr. Biren Saraiya. So if you want to look up his LinkedIn, he just posted some study over there. So you can always find him in LinkedIn and read about what he has posted there, or find him on this website, which is rwjbh.org/beatcancer. So with that, Doctor, any last tip you would like to give to our listeners quickly in a minute time or less?
I think the best thing I can tell you is please take care of yourself, take care of your health, exercise regularly, see your doctor regularly, and follow their advice.
Thank you so much for coming on the radio, and looking forward to speaking to you again, Doctor. Thank you, Dr. Biren Saraiya.
Thank you so much, Olka. Take care.